the moment I saw the project, I didn't even see the multiple imputation parts.
Yeah.
As I saw hepatitis C, I just said yes.
How would AI help to solving these issues?
If even papers that have been published are not 100% accurate on a topic, there's no way I can trust whatever AI tells me about the same topic. So
tell us about your research journey, your MPhil journey in Cambridge.
As at the time when I was applying to Cambridge, I was already academically fatigued. Because I had done 7 years of medical school and I was exhausted. So when I started the program, the first term was crazy. Oh my God, I literally wanted to die. Because I had to learn R in 8 weeks and then in the 16th week we're writing assessments, biostats. I'd never done such in my entire life. Like I had to learn the theoretical statistics, extremely challenging because it was very new to me.
Do you think the program is challenging or Cambridge itself is challenging?
I think
Hello and welcome to the ViVa, the podcast that makes research easy, simple and accessible. I am Sami Japon, a PhD student at the University of Cambridge, Faculty of Education, and the host of this podcast. Today, I'm joined on the ViVa by Dr. Akingbola. He is a medical doctor, public health practitioner, King's College Cambridge scholar. Also, he is the winner of the Cambridge Public Health Early Career Research Award. Welcome, Dr. Akingbola.
Thank you very much, Sami, for the invitation. I am excited to be here.
Yeah, I'm excited to have you as well. So, mind you, this is a relaxed conversation, but the idea is that you explain your research in a way that a 10 or a 15-year-olds can understand. Yes.
So, broadly, my research was just looking at, or just comparing two methods of handling missing data. So, normally, when researchers conduct their research, they collect data.
Yes.
And so when researchers collect quantitative data, especially, several things can happen. It's either the data was not recorded well, or the data was actually even collected well and it was lost along the way, or participants came like they were around for that particular clinic session, but did not give the information, right? Or participants did not attend that clinic session, particularly. So there are several reasons why there can be missing data when data is being collected, but how we then handle the missing data varies. And I mean, there's different debates and different methods that have been proposed and developed over time. But one problem that is existing in the research space is most researchers tend to use one particular method. That's right. And that method is called the complete case analysis, which is, to be very honest, it's very easy.
Complete case analysis. That's a key word.
Yeah. Okay. So when you collect quantitative data and you find out that a percentage of the data is missing, what many people prefer to do is to just ignore the missing data and analyze the data that were recorded. So in the process of doing that, they tend to remove all of the missing values, all of the missing spaces from their data set. For example, if somebody collected a data that has 10,000 data points, and let's say about 2,000 is missing, they would remove the 2,000 missing spaces and analyze the 8,000 data. So, I mean, that is easy and quite straightforward. And to be honest, there are scenarios where you should actually do that.
Yeah.
But also, there are scenarios where you must not do that. And when you do, your results and findings would be unreliable and would be less reliable. Right, and less valid.
No robust enough to make decisions.
Yes. So, and when you then make decisions from such results that you used the wrong missing data handling method, it might not translate to the impact that you would want it to have in the real world.
Okay.
Right? Yeah, exactly. So that's just the general. So the general summary of what my research was that I looked at a complete case analysis and multiple imputation, which is a more technical method of handling missing values. I compared them using a data set, and then I then just looked at the results and which one of them was more or produced more accurate estimates.
Okay.
Yeah, so that was what I did in the research. You know.
Wow. Thank you for that. But you've made mention of a lot of keywords, and then I would like you to unpack it further before we move on to the next part of this podcast.
Yeah.
One, you said missing data.
Yeah.
Does it mean what it means by saying it literally? Missing data. It means the data is missing.
It's missing, yeah.
Or information about people
Yeah.
are missing.
Yes.
Okay. Secondly, in which field, or because missing data, or in most research in every field, we call it data.
Yeah.
So is your work relevant in all other fields?
Yes.
Or it's specific to the area you are working, probably public health, because you also mentioned something around, or that's your field that you work in?
Yeah, so I think it's a concept that applies to every single field that uses quantitative data.
Yeah.
So as long as you collect quantitative data, you should be concerned, or you should be interested in the kind of method that you're going to use to undo the missing values. Because, for example, if you collect a data now, and you've got 40% missing data.
Yeah.
What happens is when you remove all of the 40%, one thing that happens is your sample size drops.
Yes.
And once your sample size drops, it automatically affects the statistical power of the study.
Yeah.
And when the statistical power is low, it affects the validity and the integrity of the results. You understand? So every single researcher that uses quantitative data should be interested in how they're going to handle the missing values in the data. And interestingly, I've presented this research in a couple of places, and I've received questions from people from different fields.
Yeah.
Right. And we've spoken about this concept. And one thing I also noticed is, as much as it applies to every field.
Yes.
Choosing the right method to handle the missing values in a data set is also dependent on one's field.
Yeah.
So it also has to do with one's expertise. For example, so we have complete case analysis, we have multiple imputation.
Yes, I was coming to that because I took that down and I was going to ask you to unpack. But once you've mentioned it, please explain what these two mean.
Yes, exactly. So as I said earlier, complete case analysis, you'd remove the missing values or the missing spaces from your data sets, and you'd analyze the rest of them.
So you measure it like a complete case, removing all those missing
empty cases,
exactly,
and analyzing the observed data.
Okay.
But in multiple imputation, what you do is you use statistics and an algorithm to sort of predict and guess the plausible estimates that we're missing.
Okay.
And so, for example, when you do it in R, the missing data, the missing spaces are imputed with a value across the data set. Now, the algorithm just uses the relationships between other variables to predict what that value is likely to be. So note, it's not predicting what the value is, because there's no way you can tell what that missing value is, but it will predict what the value is likely to be. Okay. Right? And that likelihood carries the variability and uncertainty that the original value would have carried, because we cannot know what the original value is. So there's that uncertainty that is there. So R would impute the guessed value into the missing spaces, and what it does is it helps you to preserve your sample size. It's not the accurate value, but it's a value that you can work with, that is reliable. Okay. Understand? So it imputes it, and you've got a robust sample size, you've got your robust data set, and then you can go on to analyze. Now, very importantly, there are scenarios where both of these methods must be used and must not be used.
Okay.
And so, in the complete case analysis now, one of the scenarios by which, or the major assumption that must be in place for it to be used is if the missingness pattern. So there's what we call missingness pattern.
The
pattern of missingness in the entire data set. If the missingness pattern is missing completely at random, then you are supposed to use a complete case analysis. Now, to put it into context, say you want to collect data sets, you want to collect data from a population, right? You want to collect data on physical activity in a population. So you've got young people, middle-aged people, and old people. You've got people that work out more often, and people that live majorly sedentary lifestyles and all. So the assumption of the missing completely at random means that when you are collecting the data sets, and then for example, you notice that some values are missing, and then during the data collection, you see that many young people are not giving, for example, like their exercise information. What it means is that most likely is that young people are not usually interested in giving those
data set
information, not because of anything, just because they are probably not patient enough to start thinking about how many times they exercise, or they cannot just accurately give you that information for whatever reason. So it's not like as if they are intentionally withholding the information. They are not just interested in giving it. So the data we're missing in the data sets randomly, not because of any specific reason. That is the missing completely at random assumption. That when you notice that pattern, you should use a complete case analysis. Now, for a multiple imputation, it is majorly done when you have a missing at random assumption in place. Now, note, the first one was missing completely at random. Second one is missing at random
assumption. Okay.
Yes, assumption. So now, for this missing at random assumption, it's so in that same population that you're trying to collect data on their physical activity, you notice that so the missing at random assumption is when data is missing due to the observed values. Understand? So you just notice that there's a relationship between other variables in the data sets and the data on exercise missing. That is a missing at random assumption.
Okay. So there are other data set on other variables aside exercise.
Yes. Okay. And then there's a relationship. For example, maybe people give this one, and automatically they do not give this one.
Like, can you put a name on this one and that one?
Yeah. So for the missing completely at random, let me start again. Missing completely at random assumption is so using that population where you are collecting data on people's physical activity. They have different ages. There's young people, middle age, there's old people, people that exercise and people that don't exercise. And also when you start collecting the data. So for example, if you're collecting data and you notice that people are not giving information on their exercise rates or rates of exercise per day. And you see that there's no particular pattern to it. And it just looks like people are forgetting to fill that part of the questionnaire, for example. That is a missing completely at random scenario, because it's the missingness or the missing data is missing due to randomness and chance. So there's no pattern, there's no reason why. It's just that people are forgetting to fill that part of the
or they're not even showing up.
Or they're not even showing up. Or probably that part of the questionnaire it has even been filled.
Or the numerator is not asking that part of it.
It's not asking exactly. Or it has even been filled, and probably when you're transporting the paper file, rain fell and that part of the paper got torn away.
Okay.
You understand? So those are the scenarios for a missing complete pattern. So it's just chance, randomness. You get, so there's no particular pattern. In those scenarios, you use a complete case analysis.
Yeah.
But in a missing at random assumptions scenario.
Mm-hmm.
The perfect scenario to use in this same population is when you notice that, for example, young people are not
Yes.
giving their exercise rates per day information.
Yeah.
So it could just mean that young people are not interested in giving the information, or young people were not so patient, or they
Yeah.
are less concerned about that part of the information,
Mm-hmm.
and they're not giving it. But in the data set, you see that most of the people that are not giving that information are between age 16 to 20,
So there's a
to
pattern
29.
to it.
Yeah, there's a pattern, and it is related to one or more of the variables in your
the
data
data
set.
Yeah.
So that is missing complete. That's missing at random.
Mm-hmm.
So in practice, it is simply defined as when the missing data is related to observed values in the data set. So in this example, it's the this young
people.
age, the young population,
And within a particular age group.
Yes. Yeah. Then for a missing not at random assumption, it's in this same example. It's when the missing data is related to the unobserved values. So for example, it's if you give the questionnaire to someone that is obese, for example, that does not exercise at all, they could intentionally leave out that information because they did not exercise.
Okay.
So
that's a missing unobserved variable.
Yes. Yeah. So because of that in that scenario, it's a missing not at random.
Okay.
Yeah, and honestly, such scenarios are the most difficult to handle because there is no. So I will discuss about some of the issues generally around
the challenges that you face.
This field of research, but the bottom line is when you have a missing completely at random assumptions scenario in play, you are right to use a complete case analysis. You are right to remove all of the missing spaces, exclude them, and just use your observed data. And when you have a missing at random assumption scenario in play, you do a multiple imputation.
Okay.
Exactly. So when you do that for both scenarios and both methods, you are going to have robust results and inferences that you can trust and then that you can rely upon. But when you use them outside of those assumptions, outside of those scenarios, you are going to have results and inferences that you cannot trust, that are less reliable and less valid.
I see. Thank you very much. I have a follow-up question to this before we move to the next. Okay. What if you are analyzing the data and actually people skipped the data sets or don't know? Normally in quantitative research analysis, so viewers, because I have a bit of economics background, so I did my both masters and then bachelor's in economics, and I'm currently using quantitative analysis. So I'm very aware of what you are talking about, but then for our audience, we need to make everything simple. And genuinely, people put other, skipped, or don't know. Normally, we put this as missing. How do you deal with this?
Yeah, so my thoughts are currently with my level of understanding in this area.
Yeah.
If other or don't know is part of the
questionnaire,
the options in the questionnaire, I think that it should be represented in the analysis as an object, as objects on their own. Yeah. So because if for example, it's a variable and a significant number of people that answered that particular question say that they don't know, they don't have a response. I think removing it first of all would reduce your sample size, could reduce the entire data points. You understand? And also imputing it does not really make much sense because it's an object on its own. It's a response on its own. So the best thing that I would do in that scenario is I would let them have their representation in the analysis and in the results. So if I'm reporting the results, I would say, 95% of the respondents said or expressed that they didn't have a response to this question, or they did not know about this, or they did not have an idea, they did not have an awareness about, or they didn't have knowledge about so and so question that I was asking. So in that scenario, I wouldn't remove them. I also wouldn't do an imputation. I would make them represented.
Okay.
So in that scenario also, it now depends on your contextual expertise. Now, so you know the questions, you know the question you're trying to answer, you know the data that was collected, you know the broader implication of responses in the data that you've collected. So you're going to have to be very careful about how you handle that aspect,
particular
because
variables.
Those are people's response. People actually responded. You understand? And for me, I like to treat every single data point as a human being. Yeah, so if, for example, 95 out of 100 people said they don't know, that is 95 people. I mean, in an Excel sheet, it could look like 95 data points. It could look like something that you could easily discard. But in reality, that's 95 people's responses. So I think that's if you already put in that option in the questionnaire, it should have its own representation in the results.
Okay, thank you very much. My issue would have to do when you're running a regression analysis with it. Yeah. So a regression analysis, if I could explain a bit further, is when you are trying to find a relationship between two or more variables. So you have the simple regression or the multiple regression. So when you are running a regression analysis of this, an example, if it's either your outcome or independent variable, would you still add the other, and even explanation of it will be a bit difficult? You can say you don't want to answer this,
so
and then we skip this.
It's a very interesting question. Yeah. So if other is part of the, so for other or don't know to be part of the questionnaire, it means it is likely a categorical or
variable,
right? So it means that it can be used in a regression model without causing any issues. In fact, interestingly, if you replace those other or don't know with NA or with empty spaces, it would not still affect the regression model. Because the regression model will still run its model with or without.
Yes.
Without
exactly. But then the interpretation of it will be the issue.
Yes. So in the interpretation of it will now become a little bit of an issue. But then again, if it now to still depend on one's contextual expertise, you get to interpret the results. But I still think it should still be there.
All right. Thank you very much. This is why we call it the ViVa. We ask the critical questions, and it's our goal to explain it in a way that is very accessible. Now, you are in public health. You've done medicine. What are you doing in data analysis like this and all that? And how does this fit? What's the link, and what are you doing with this?
Yeah, that's a very good question, actually, because 26, 5, 4, 3, 4 years ago, if you'd ask me if I would be interested in anything about research or data, I'll tell you no. I would give a very capital no, because I really disliked research. I disliked data, but I could see its importance, but I still disliked it because I felt like it was going to be a lot of work. Because then I was neck deep into medicine, traditional medicine as it is, because I was in medical school. So and because in medicine everything has a structure. I mean, you have to you know what to do once you see a set of symptoms. There's a process by which you can think through it. You can make educated guesses. You can even carry out investigations, that's tests. You can then arrive at your diagnosis.
Exactly.
So there was a structure, but at that time I knew that with data, when it comes to data, there isn't a predetermined or predefined structure. It's you as the analyst or as the structure that would then give structure to whatever data you want to analyze. That was my problem with research and data initially when I was in med school. But when I got to my final year, I realized that I could no longer continue to run away from research and data, because as much as I disliked it in previous years, there was a point where I started to like it and I started to want to know it. And so I just realized that generally, whenever I have a dislike for a concept or something, I usually end up liking it because I just want to overcome that dislike. I just want a cloud to continue to dangle over my hand. That is how it is whenever I dislike something. It seems like there's a heavy cloud over my head. And because I just want that cloud to leave, I need to resolve it.
Yeah.
So in my final year, I started to pick interest in research and in data, and I knew that the first thing I needed to do was I needed to get skills, get the knowledge and get the skills. And that was when I applied to the University of Cambridge for the program. And then I learned the basics and then how to use tools to analyze data. And also the most important part of my response to that question is when I started my master's program and I started to work with data in the program, I was very challenged. So I was so challenged to the point that I first of all had to abandon whatever traces of dislike I had.
Okay.
I first of all had to abandon whatever love I had for other things. Because again, for me to succeed in something, I need to really, really like this. And that's something about me. So I have to abandon my love for every other thing, including medicine, and just focus and just act like I loved research and loved data. And in that process, I eventually fell in love with research. I fell in love with data. I fell in love with what I could do with data and the insight that I could extrapolate from data. And even much more specifically, I realized that in Africa, whenever policies are enacted, whenever policies are made, we don't get to see how the policies were even developed in the first place. We don't get to see or know the evidence or what evidence was even used. So I can subjectively, please, I said subjectively, can subjectively assume that so many policies are not even evidence-based in the first place. Yeah. Because I've lived in the UK for a few years. Whenever they want to bring out a policy, there's usually data, there's usually evidence. There's a white paper. The white paper contains all of the evidence, the quantitative, the qualitative, every single process and method that was used, every single
explained.
Yes, every single study that has been done in existing literature and every single thing would be explained. So you could easily trace back the policies and recommendations from or to evidence. But in Africa or in Nigeria specifically, I don't see that. It's possible that they use a lot of evidence, but there is no communication of this evidence. So I don't even know. You understand? So along the line, during my master's program, I began to see the usefulness of data and how data can be used to generate evidence or generate insights, and then insight can feed into policy making and drafting of recommendations. And it was at that point that I knew that, okay, it seems like I want to develop my career trajectory in research. Okay. Yeah, because as much as I already like it, I also see very significant impact in the field, especially from in Africa. So that is how I found myself in this field, working with data and then working in the research space.
Okay. Thank you very much, Dr. Akingbola. So I did some little digging about your master's thesis at the University of Cambridge, and then you wrote on improving prevalence estimates of hepatitis B in key populations. Yeah. What motivated you to do this?
Yeah, so that is a very good question, because we actually had about a list of 100 possible thesis
questions,
topics to choose from, right? And for me, I've had background public health practice experience in viral hepatitis, because in Nigeria, I founded a non-profit project called the Health Drive Nigeria, and what we basically do is we try to create awareness about infectious diseases, common infectious diseases in our environment and then in the country, and then all of that. And then at some point, we sort of also ensured that our major focus was viral hepatitis. So we usually conduct free rapid test screening for viral hepatitis B and C, and we also conduct highly subsidized 3-dose vaccinations for viral hepatitis B, especially in low to middle income communities in Nigeria. So I've been doing that since 2018, and I have this very uncommon love for viral hepatitis. So the moment I saw the project, I didn't even see the multiple imputation part.
Yeah.
As I saw hepatitis C, I just said, yes,
This is it.
that is it. So immediately I emailed the supervisor and then we spoke, and then it was later I got to understand that what I was going to do, it was purely it's purely biostatistic concepts of a thesis rather than the usual thesis that I would have wanted to do. But I wanted to do maybe something less technical, but I had no choice because it was about hepatitis C. And aside from that also, when I then eventually understood the importance of the project, I just loved it, and I knew that, okay, this is something that is very, very important because truthfully, me too, if I want to analyze a data, I would just even close my eyes and remove every item. But the multiple imputation is a good skill to have for me as a researcher, and it's also a good skill to do for the project, and also that was why I did it.
I'm curious, what is the finding of your project?
Yeah, so
I like the way you sigh on this
finding part.
Yes.
Sometimes I don't see it as a finding, sometimes I see it as a finding, but what was interesting to see...
Yeah, tell us the most interesting part of your research.
To see was that apparently when I analyzed the data sets with both complex case analysis and multiple imputation,
yes,
I saw that the plots that were produced were a lot more consistent when I used the multiple imputation, and the plots produced when I used the complex case analysis was just all over the place, haphazard, and didn't really have clear meaning. You get in quotes. But what I would say that made the distinction was that, for example, when I computed the hepatitis C prevalence trends over the last 10 years, so there was a part where the hepatitis C prevalence started to decrease in the United Kingdom, and that was from 2016. It started to fall, decrease. Yeah, so that decrease, it actually coincides with the widespread implementation of direct acting antiretroviral medications that was pushed through the NHS in the UK that year or the year before. So that explained the reduction,
the drop in the
drop, and the drop was a lot more visible and clear when I used the multiple imputation method. Now, another interesting finding was that when I used the complex case analysis, there was a sharp rise between 2013 and 2015. A very, very steep rise that was unexplainable by literature, I literally combed the entirety of literature. I combed news articles. I combed grey literature generally. I could not find any plausible explanation for why between 2013 and 2015 there was a sharp rise, that sharp spike in hepatitis C prevalence in the UK, because it didn't make sense. From 2010, it has been increasing bit by bit. You understand? Then 2013, it just went. 2015. For example, if it was COVID, if it was 2020, I would say COVID led to a drop in treatment or something. So then the prevalence increased. Yeah, increased or something. Or there was more testing and less treatment. I could have come up with an explanation that would be backed up by literature. But for the rise between 2013 and 2015, there was literally no explanation. So when I then checked my data set back, I saw that actually 2013 and 2015 had highest missing data in the data set. So it was likely an artifactual increase when I removed all of the missing data sets. So that was what made the entire plot a little bit chaotic. But on the multiple imputation plot, it was actually very clear. It just showed the gradual decrease over the years till it got to 2016, and then the sharp drop showed. So I could just make, again, subjective inferences that I think this multiple imputation process has given me much more consistent plots and much more consistent results than the complicated analysis. Also, finally, another thing I also noticed was that my confidence intervals produced when I used the multiple imputation were tighter compared to the confidence intervals produced when I used the complicated analysis. I know in epidemiology, once you have tighter confidence intervals, it sort of indicates precision.
Yes.
Yeah. So.
Yeah, but not all the audience understand what confidence interval is.
Oh, yeah.
So if you could
explain.
unpack that.
Yeah. So confidence interval is basically a range of values where you are likely to find a point estimate inside. And point estimate, a very good example is the odds ratio. And so odds ratio is the ratio of events happening, or is the probability of an event happening.
Yeah.
So if you can find, so if you have a value for your odds ratio, your confidence interval is now the range of values where you'd find that values inside. For example, if your odds ratio is 1 or 2,
yes,
your confidence intervals will be 1 to 5 or 0.5 to 5. You get, so that is the confidence interval. And then, so statistically, when you have a tighter confidence interval, it indicates that you have more precise results
and reliable results.
Yes, because are closer to the odds ratio from both sides.
Yeah.
So that was what I was able to see from the two results. And
wow.
To me, it was quite interesting actually to see.
Yeah, it is interesting, and I like the fact that you didn't explain the results in the context of what the data is showing. You aligned with the policy trends in the UK, where you talked about the drop in the sharp drop in the multiple imputation graphs, and then it's coincided with a policy on antiretroviral drugs, as well as there was no context or literature to explain
why there was a sharp
rise in the complete case analysis. That is really good.
Yeah, it's good. In fact, interestingly, I saw that between 2015 and 2016, or 2015 and 2017,
yes,
the NHS actually dropped the price significantly of the direct acting antiretroviral drugs. Like, significantly dropped the cost, so it was easily accessible
for people to get. Okay.
So despite the fact that they increased testing, but because the drugs were easily accessible, it's made, since then up to now, the prevalence has been going down up to now.
Like they say in literature or in academia, there's no method that doesn't have challenges.
Yes. So,
what are the issues or challenges with the multiple
imputation
method? And are there any situations where it might be the wrong option or even the best? Now you explain if it's the best option, but are there situations where
it could have been,
or what are the challenges? And
so as I was saying earlier, one of the most important scenarios where it would definitely be the wrong option is if the missingness pattern is completely at random. And then using the sample population that I was using, if you notice that a particular variable is not being answered in the questionnaire or in the data set, and you cannot find any plausible pattern or any reason why, and it's just random because people don't.
So you go back to your initial explanations.
Yes. So in that scenario, you're supposed to ignore those unanswered parts and then do a complete case analysis and analyze your answered parts.
Okay.
But in that scenario, if you use a multiple imputation, the results will be less reliable. Yes, because for those unanswered parts, you don't need a response because the response was not given due to randomness, due to chance. So you don't need to impute it. You don't need to fill it up because but if it was filled and it was lost, it was, or the people intentionally did not fill it, then you would want to impute. So in that scenario, you should not use a multiple imputation. Now the problem, even up to now, I still have that problem. And so the problem is, how do we determine what scenarios are at play in the data set. Imagine that you were not the one that collected it.
The data.
You just gave a data set to analyze.
Like me, I use data set from the World Bank to do education
how would
analysis.
you know that they collected it but it was lost, or the person intentionally did not give the information to the person that was collecting it, or it was just random? How do we know? For me, that is the most challenging part of the research. But there's a way you can partly know, but you cannot completely know.
No.
So the way you can partly know is you can run a statistical test called the Little's test. Now, the Little's test will only let you know if a missingness is missing completely at random.
Okay.
So the results will be either missing completely at random or not.
Okay.
So it won't tell you that it's missing at random or missing not at random. Just missing completely at random or not.
Yeah, but at least that will make you know to use the multiple imputation or not.
The complicate
analysis
or not. Yeah, but if it is now not missing completely at random, you don't know if it is missing at random or missing not at random. You don't know. So what you will then do at that point will be probably to look at your entire data set. It will now depend on your expertise. You're trying to see, so because a missing at random assumption is that the missingness is due to observed data.
Yes.
You will now start looking at it. Okay, this is the variable that I want to use. For example, what other variables are sort of related to it, and try to find relationships and know. But that part is not easy.
Okay.
It's a very huge challenge, and so those are parts that I think are challenging even to me up to now. And I think it's probably because I'm not a mathematician or a statistician.
Yeah.
That's why.
Yeah, but maybe that's also another research you could unpack. And then once somebody has done the little test, you could also bring a test that could observe the pattern and could actually tell what kind of randomness it is.
I really hope somebody out there is working on it.
Yes.
Like, I would really love to see.
It's a sign. You should work on that. Yeah. Okay. Now, you mentioned that one of the things that motivated you to do this is that policymakers were flying in the dark. What I mean by this is that they were making policy decisions without data and evidence.
Yeah.
That could be one of the real life or significance of your work. Yeah. But could you tell me more? What is the real life application of your work?
Yeah, so first of all, I think generally, if we're able to determine the missingness patterns in data sets, we're able to use the appropriate missing data handling methods, of which, by the way, there are more than just complex analysis and multiple. There are a lot. So if we're able to find a way to streamline all of this, to first of all be able to identify the missingness pattern, and then be able to sort of objectively know which method we can use to handle the missingness, I think several policies, several results would be very reliable and would be very very valid. So generally, the implications. So because most research outputs are what we use to develop policies. So if the missing data is not really handled, I mean, how can you even trust the results? If you can't even trust the results, how can you even trust the policies that are emanating from the results? And more importantly, are we surprised why we do not achieve 100% impact when policies are implemented in their best form? I'm not surprised, because some policies might have been enacted or might have been drafted on the back of evidence that used data, that used the data that its missing data was not really handled well. So it just has this chain of consequences. Your results will not be trusted. The policies would not also work as much as it should, and then on the impact side, you would not really see 100% impact as you ought to see. So you now then, because this concept also applies across several fields, so you also see this across several fields too. Results that are not really accurate, policies that will not work 100%, and impact that will not be complete and total. So generally across board you would see it. So that I think is the real world implications of not handling missing data accurately. And honestly, I think that it's a field that is open to a lot of research investment. It really need to do a lot more research in that area, and we really need to resolve all of this. But one part of me also believes that the more we dig into these areas, the more questions come up, and then the more we try to solve the questions, the more questions come up. So
how would AI help to solving these issues?
AI, the only way
I like the way you like AI.
One would think,
tell us.
One would think AI should just be able to close its eye and just tell us, oh, this is missing at random, this is missing. But AI is using data. So AI is using information that is
which is also missing.
AI can be using data.
Missing data to make suggestions. Actually, when ChatGPT came up first, it was hallucinating. It was because it didn't have enough data set. So that is a perfect example of missing data.
It could be. Yeah. But AI also is restrained with data.
Yeah.
And even if the data that was used to train the AI, we don't even know how the missing data was even handled in the first place. So if it was not handled accurately, AI would tell us about those data and what was used.
Yeah.
AI's response is basically of data
the data it has.
It was trained with.
Yeah.
So
I get you.
So one interesting feedback I got when I submitted my thesis was that even in some part of my literature review that I did, because I cited some papers and some of the comments were that even some papers I cited were not accurate. So like even papers that have been published on multiple invitations, they were not accurate. But me, I am not a professional. I am not a professor. There is no way in this world I would be able to tell that this paper is
not accurate.
For paper that was published in Nature, how will I know that the paper was not accurate?
Yeah.
I'm just a pencil in the hands of the creator. You get so if even papers that have been published are not 100% accurate on a topic, there's no way I can trust whatever AI tells me about the same topic. So I don't know if AI would be instrumental in solving that big research gap in that area. I don't know yet.
Yeah, let's give it time and see. Tell us about your research journey, your MPhil journey in Cambridge.
Yeah, so it was actually a very interesting journey because I sort of had an idea of what I was coming to do, but I just did not know how intense it was going to be. You understand? And even at the time when I was applying to Cambridge, I was already academically fatigued because I had done 7 years of medical school and I was exhausted. Like I was literally mentally fatigued. But I just, even my final exams in medical school, I summoned strength from
all angles,
everywhere, from outside the world to just push.
Yeah.
You get, so I was fatigued. I just wanted a break. But interestingly, so I applied, I got into Cambridge. So I had to reorient myself. I had to re-encourage myself in that I think I just have to do this. I have to do this. I have to be at my best mentally. So I had to re-encourage myself, and then I was able to encourage myself properly, and I was able to have get my attention back, get my focus back, and most importantly, when I want to delve into something new, I find a reward system for myself. Okay, so marks, academic scores and marks have never really been a reward for me, for the hard work I put in academics.
Yeah.
So I usually find my own unique reward system. So in my head, I already told myself that, okay, if I'm going to come to Cambridge, I need to define what I'm going to gain outside just passing and getting my degree and outside learning. I have to just gain something else. That something else is my own reward from the normal reward I'm going to receive, which is the degree. So when I started the program, the first term was crazy. Oh my God. I literally wanted to die because I had to learn R in 8 weeks and then in the 16th week we're writing assessments, biostats. I'd never done such in my entire life. Like I had to learn the theoretical statistics.
So those were challenging.
Very, very extremely challenging because it was very new to me. So I did that and I learned it as fast as I could, and then when I saw that I did very well in the biostat assessment, I was proud of myself because it was not easy. Yeah, so actually one marker gave me a distinction, the second marker gave me a pass. I don't know why the marker gave me a pass because even in the comments, I mean, I didn't really do anything that was that bad, but of course different assessors have different preferences. Yeah, but that result really encouraged me, and that was actually the first time in my entire life that I would see a result and I would be moved. In my entire life, whenever I do an exam, whether a result is good or not, it doesn't really move moving. But that first time, this time when I saw it, I was moved. I knew that, okay, I think I am interested in this. So
do you think the program is challenging or Cambridge itself is challenging?
I think it's both. Cambridge and the program. Two challenges together. Yeah.
And how did you deal with these challenges?
The major thing that helped me was my classmates and my friends, because we had other Africans in the cohorts and the Nigerians. So, and I was very close with all of them. So we helped each other. We practiced. We asked each other different questions, and also we really helped and supported each other. And that was one of the factors that really helped.
So a community.
Yes. The community. I could remember before the assessment, the biostat assessment, myself and two other Nigerians in the program, we met up for like 3 days back to back, morning till night. We were revising every single concept. Sorry, I want to sneeze. Okay.
Yeah, go ahead.
We're revising every single concept that we were taught in the program. We developed questions for ourselves. We analyzed. We generated data from online. We analyzed the data, and then we revised. And it was in fact what I gained in those 3 days was what I gained in the entire period that I did the biostats course. It was really, really helpful. So when I did the assessment and the results, I loved it for the first time.
Because you put in a lot of work.
See, I used to put in a lot of work normally, but for some reason, I think it was because I had previously disliked it. And then when I put in effort, I got a good result. I was encouraged. So I knew that, okay, this thing. Then I signed up to do the advanced biostats in the next term. So then from there, I saw the dissertation topic, and then when I realized the kind of technicality that it would take, I was not faced. I was not scared, because if I could quickly learn the biostats very early, like very rapidly, I think I would be able to handle the dissertation.
So with all these challenges that you've been able to overcome, if let's say an African or international student is coming to do this program, probably from a medical field like you, what advice would you give them?
So, but interestingly, for example, I am more or less an average student. So I don't usually I don't compare myself with people. Some people are extremely smart.
Yes, that is Cambridge for you.
Some people are extremely smart. In my class, there was a fourth-year medical student in the UK. Oh, this guy is very good. So that's just the way I see people. I see every other person as extremely smart, and I see myself as the average human being. You get, and also I'm very sure that any medical doctor or any medical student that enters the program would do very well. Like averagely, they would do very.
What should they do? What specific advice would you give them?
So more specifically, I would just encourage them to have some experience with statistics, have some experience with using tools like R or Stata to do some analysis. Even if it's basic descriptive analysis, they should have some experience. So at least they are transitioning to using those tools in the program would not be as hectic and difficult as I went through. So they can have some experience around that to really be helpful. But most importantly, I think that a medical person or a health professional should strive to push themselves. You get, so we are mostly comfortable when it comes to medical stuff, because I assure you, medical school training was more than enough for us to be very comfortable when it comes to medicine. Very comfortable. Like, we can close our eyes and we can continue to talk about concepts in medicine. But when we have opportunities to be outside of medicine, I think we should push ourselves. We should challenge ourselves. We should go all in and go all out. For example, I just had to push into biostat so much that I had to do this dissertation, and I really loved it. I liked it a lot. So that's what I would just say. Just be ready to challenge yourself, ready to push yourself, and you should actually be excited to challenge yourself. Yeah, because you know that at the end of the program, you would be very happy with what you've learned and the skills that you've got.
That's good. Yeah. So you heard him. If you are coming to do a program, the Public Health Sciences program in Cambridge, one, you should get a skill in statistics and your ability to use data R or Python, or any of these statistical softwares. And if you are coming from the medical field as well, you should be willing to challenge yourself beyond the boundaries of knowledge that you already have. Yeah. We are going to the final section of the program. And you see these papers here.
Yeah.
I'm going to shuffle it a bit. Please. We have 2 yellows and 2 white. You pick one of them. It's a question. And it's supposed to be a fun question. This is the fun part of the ViVa. And you respond to it. So once you pick it, you give it to me. I read it to you and you answer the question. Are you ready?
All right.
Cool. Let's go. Do you want me shuffling it more? Okay. It looks like you have your eyes on some.
But I want to change my mind. I want to.
Okay.
Let me see. Let me make it a little spontaneous. I don't know what will be there. Should I give it to you to read?
Yes, you have to give it to me to read. All right. Okay. If your research had a headline and you want everyone to read, what would it be?
God, I beg you. If it had a
headline, yes.
So, what's coming to my mind is the headline will start this way. I don't know, exclamation. Have we been getting things wrong?
Okay.
Question mark.
So
the breakdown of that headline, everybody will now go and interpret it in their head. I don't know. I don't know. But have we been getting some things wrong? Because if we've indeed been getting some things wrong, it means there's a very big problem in our hands. Or it means that we have an opportunity to get things right.
Okay.
But first of all, I don't know. It's just a guess, just a suggestion. I think it applies for this project because if, in fact, 2 years ago or last year, I had an intention to actually do a systematic review of papers published in a particular field in health, in medicine or health, to see which missing data handling method they actually use.
Yeah.
So when I just did a rapid review, I saw that most journals don't even ask papers to declare their missing data handling method. Most papers did not even. Many papers in different fields did not even declare that they had missing data at all.
Yeah.
So there's a lot of aspects to this. There is
how to
aspect.
deal
There's
with
also
missing
the
data.
transparency aspect, transparency and accountability aspect. Because if a paper did not mention that it had missing data. Nobody would ask how it handled the missing data in the first place.
Exactly.
So it's problematic because we don't even know if you should trust or not trust the result. So I was in a conference, and then somebody was presenting, and then the person was saying something. Then I think for one reason or the other, the person mentioned something about missing data. And then somebody asked the question that, what percentage of the entire data do you think was missing? He said about 60%. And they asked him, how did you handle it? He said he just removed them. And then a few people in the hall that understood him, they knew that you just removed them just like that. So let's say you had 100 sample size,
and 60 is missing. 60 is missing. Just analyze 40.
You analyze 40, and then you are like talking so enthusiastically about your results and how it can be used in the real world. How do we even know that your results is even correct in the first place? So there were a lot of back and forth there, and then so that just shows that many people, including very, very top researchers, don't like to talk about that part of research because then a lot of questions can start getting asked, and also it's a problem. Honestly, it's a problem. It's a problem I wish can be solved. Honestly, So
thank you.
That is what my headline would be. That I don't know. No problem. Video. In fact, it won't be in pidgin. Problem video.
Okay. That's really good. And from what you say, I have a story that aligns with exactly the two key points that you talked about: missing data and then data transparency. So I had been meeting my supervisor for a while, right? And every time I go there, and then I go and, blah, 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 just make myself look good. And he's like, Sam, in our next meeting, send so in Stata, you have a do file. A do file is where you save all your codes. So send your do file in your data set. I want to see. And I went there, this man, analyzed, and then he said, okay, there's this, why do you have 10% of this particular variable as missing? Then I tried to explain it. No, try to understand why there's missing data. Go into the questionnaire, understand the context, and explain in your work why you have this amount of missing data. So then I had to do that, and then the way that I solved is that I had to combine. So the missing data was coming from mother's education and father's education. So I had to do more coding into it to understand why it's missing, and then I had to combine the two to create one variable which is called parent education, which merged exactly
human robust.
So that is one way that I had to overcome this challenge, and it boils down to, or touched on the two things that you said: missing data and data transparency. So now I save every code that I do in my research, and as well keeping check of my missing data sets.
Yes.
So, I'll ask you one question. It's a fireball question. Don't say much and don't say, don't explain much. Okay. Is your research transparent? And can it be replicated?
Yes, it can. Replicability, yes, it can be very much replicated, because even in my thesis, I drew a map of everything that I did.
You did, okay.
So anybody can replicate.
All right.
So in terms of transparency, yes, it can be. It is transparent because I did not overstate my findings. As I said earlier, in fact, sometimes I don't think it's a finding, because I think it's just logical. But again, different researchers would have done it in different ways. So I think within the context of what I did, it is 100% transparent.
Thank you. Is there any question or is there anything you would like to say that I didn't ask?
Let me see. Well, one thing I would like to say is more or less a disclaimer, and is that I am not an expert when it comes to this missing data, because if in my thesis, the people that reviewed my work said that even with the papers I cited were wrong. It just shows that I'm just somebody I just wanted to pass. And
stop being humble, my friend.
No, I'm serious, because
you've published so much work, over 15. How many do you have? 20 something?
Just a couple.
How many? Put a number on it.
If I can put a number, probably 51 or 52 now.
This guy has 52 publications.
Yes.
And yet he says he's not an expert.
I mean, no, in missing data. You see, I'm missing data.
Okay.
Each time I'm even writing papers, I try to avoid it too, because when experts sit down and analyze and talk about what you've done, hey, you would be scared.
Yeah.
And it's because it's a very technical concept, and maybe people that actually play in this field are mathematicians and statisticians. So they're the ones that have very strong background in the area. So
you didn't add economist when we were.
Yes, economics, because
it's okay.
you guys do a lot of
ignore that, but it's okay.
Mathematics related fields
exactly
are the ones that would really have strong backgrounds. Me, I was opportune to do my thesis in that area, and I really loved the opportunity. So the next opportunity I had, I ran away from the field because I cannot.
All right. Thank you very much. Thank you for joining the ViVa
you're welcome.
And for sharing your research as well as your journey.
Thank you very much for the opportunity.
And to you all, thank you for staying with us and watching to this part. We are going to end. And before that, I want to say a big thank you to the editors or the production team, Isaac Apia, who is editing the work. Music is coming from Pixel Bay. And this beautiful and lovely studio is West Hub Studio, University of Cambridge. If you like what we have discussed, please like and subscribe and share this channel with your friends. Until then, see you in the next episode. Bye-bye.